So you've been diagnosed with an allergic reaction. Here's what you need to know and a bit of what you might like to know. So in the emergency room, we often don't know what your allergic reaction was from. If it was a severe reaction, though, we recommend that you see your family doctor to get an appointment with an allergic clinic or an allergy specialist to get patch testing. Once you get patch tested, you know what you're allergic to, and then you can avoid it in future. This is less important if it was a mild reaction, but in a severe reaction, it's very important to know what to avoid in future. If you've been diagnosed with an allergic reaction, you probably had hives. Hives is a rash that's all over your body, usually chest, arms, back, legs, and it's big red blotches, say, on your arm that moves. So in 1 hour, they might have one over your wrist and elbow, and you look down 45 minutes later and they're gone, but there's a new blotch in the middle of your forearm and up on your shoulder and wherever else. So the blotches are moving, and that's called hives. The treatment for an allergic reaction is to take Benadryl or diphenhydramine. I have some here. You don't have to buy the brand name Benadryl. You can just buy the generic form of diphenhydramine, which is the same thing. These are 25 milligram tablets. So you'd actually want to make 50 milligrams is what you want to take when you go home. And I want you to take it for 48 hours or 2 days every 6 hours. So that's because some patients will have an allergic reaction and then it goes away and comes back again at 48 hours. I actually see them come back to the emergency room surprised that they're having the reaction again. If you're taking diphenhydramine or Benadryl for 2 days, that won't happen to you. So you take it every 6 hours or 4 times a day for 2 days. If you find that you're way too sleepy when you take 2 tablets of Benadryl or 50 milligrams, then you can replace the daytime tablets, the 2 doses, with a non-drowsy formula like Reactin. And it doesn't work quite as well, but it is fairly effective. And then you still need to take the 2 doses in the evening and overnight for the 2 days. So that will get you covered there. You may have also been given a prescription for prednisone. This is a strong drug, and it'll make your sugars go out of whack for a few days while you're on it, and you'll probably be quite moody as well. But it is very effective at getting down the reaction, so it will be much better if you take it. Do take it if you've been given the prescription, and fill the whole prescription. Usually somewhere from 5 to 7 days is standard for most emergency physicians. If you've been given a prescription for an EpiPen, it is critical that you fill it. Go to the pharmacy, make sure you get it filled right away, and do not be afraid to use it. It's very important, and it could save your life. Many patients are afraid because it's a needle, they don't want to use it, but if you start feeling one of 3 things, you must use it. And those things would be, number 1, any kind of symptoms in your lips, your tongue, or your throat. Many patients describe eating something, then having a weird tingling feeling in the back of their throat. That would count. Anything in your lips that are swelling or your tongue. This means that it's going to be very difficult for me to protect your airway so that you can breathe if the swelling gets worse. Don't wait. Just take the EpiPen, slam it into your thigh, and get the medicine in there. The worst that's going to happen is your heart rate's going to go fast, which is what happens when you go for a jog. You'll be just fine unless you're 90 and have a terrible heart, so do use it. That's number 1 if you have anything in your lips, tongue, or throat. Number 2 would be you're having difficulty breathing and making a funny sound when you breathe. And number 3, you're feeling lightheaded or like fainting. Another reason to take that EpiPen. The EpiPen buys you about 30 minutes. That's enough time to get in and see me, or the emergency physician who's there. So do call an ambulance, take the EpiPen, and come in. You can't just take it and then say, well, I've treated it and I'm fine, because it'll come back in 30 minutes. It buys you a little bit of time to come in and see the emergency physician. I'm Dr. Atzema, and those are my discharge instructions for an allergic reaction.